Thursday, April 25th. About 5 weeks left to leave to Los Angeles. Getting very close to surgery. I've heard from a couple people that they're very interested in learning what kind of surgery I'm having and what makes it so different. So I decided to talk a little bit about this surgery and why it's so different than the traditional myomectomy, which is the removal of the thyroid tumors. First of all, as you know, I'm flying to Los Angeles on 30th of May, which is Friday. And then from there, I'll be having surgery with Dr. Del Junco, Tirso del Junco. I will be seeing him Friday the 31st in a preoperative consult for a couple hours. And then from there, I will be heading across the street to the hospital to do the pre-admission check-in and x-rays, blood work, those things that they require typically before surgery. And then in the afternoon, about 1 or 1:30, I'm seeing the internal doctor. I would do the preoperative clearance with my doctor here in Florida, except I guess in California the laws are a little bit different, so I'm required to see a doctor there in California. But a traditional myomectomy, they can do usually through a small pinhole precision laparoscopically. Those are okay that kind of surgery is okay when it comes to smaller fibroids or less fibroids. But when you have multiple and especially large fibroids like mine, it does require an abdominal incision at the bottom. It's basically a bikini line incision, how they would normally do a C-section. So that is the type of surgery that I'm having. They're going to open up through an open abdominal incision. Normally during a myomectomy, there is significant blood loss, and also blood transfusions are quite frequent. And Dr. Del Junco is quite different because he has several techniques which help avoid both of those. The first thing is that when he goes in, he will actually drain the uterus of the blood. I'm not exactly sure how he does that. And then they apply a tourniquet really at the base of the uterus. So this really helps to kind of remove the blood and take the blood away from the uterus so they can work. And that's really what makes it bloodless. So I know I've got that question from several people. The thing that he does is that he injects some sort of medication into the uterus, and that also helps control bleeding while they're working on it. Additionally, he uses a special, I think it's called a YAG laser, I'm not exactly sure, and another type of laser. So when they cut the uterus, they do very little damage to the uterus, and the muscle of the uterus is retained. So I know that helps with the blood loss as well. So hopefully that answers your question. I know a few people have that. Also, what's very unique about this procedure is that most myomectomies, whether laparoscopic or through the abdomen, bikini line incision, they put the patient completely to sleep. And I'm not averse to that, obviously, but there's a few things that happen is that when you're put completely under general anesthesia, when you come out, quite often you feel nauseous. So if you've had any kind of abdominal surgery, it doesn't matter where they did the incision, laparoscopic or abdominal, there's a tendency to get very nauseous and want to heave. You obviously have nothing on your stomach, so there's nothing to throw up. And if anyone has ever had abdominal surgery, the last thing you want to be doing is that deep welching, that trying to throw up, because it really, really hurts. Also, too, it does take longer. The brain is a little bit fuzzy. And in this surgery, they give you a spinal epidural, just like you would when you're having a C-section and you're awake to have the baby. They do the same type of procedure with a slight sedative, kind of relax you. You are numb pretty much from the chest down, and so when you come back, you don't require as many painkillers because slowly the anesthesia is wearing off, and it allows you to not feel the pain. And also, too, you're awake, so you're more cognizant, so it's going to be a little bit easier recovery. So obviously, being awake is ideal. However, I know I've read some of his testimonials. Some women just can't be awake for whatever reason, and he gives you the option to go completely under if you want to. I'm going to try to do the spinal epidural route. And I know during the middle of surgery, I was talking with Patricia, the coordinator. She said if it becomes too much, you can always tell the anesthesiologist, and they'll give you just a little bit more sedative, and off you go. Sleepy time it is. I'm going to try to stay awake. I think for healing, recovery, less pain medication, that's really the ideal way to go. During the surgery, since I will be having epidural, some people kind of, oh, I can do that. They have a TV monitor, so you can actually watch your own surgery while it's going on. I don't know how much I'll remember with the sedative, but it is your option. If you're squeamish, obviously they can turn off the TV. And I think that's kind of cool that you'll be able to at least watch what's going on while it's going on. The other thing that makes this surgery very unique is that when you have any kind of surgery, whether it's laparoscopic or abdominal, there's always the adhesions that form. There's the thick scar tissues that form, and that can cause lots of problems. The organs stick together. Sometimes adhesions become very dense, thick, and they become painful. They actually are almost little masses themselves, and surgeries have to be performed afterwards just to fix them. In this surgery, the doctor uses special irrigating fluids to kind of flush out around the uterus and obviously the bowels and things like that, which help when the uterus goes back in not to stick. Additionally, before he puts the uterus back in, he wraps the uterus in a special mesh, so that doesn't allow other organs that were exposed to air to form adhesions. Sometimes they do form adhesions, but not as badly as you would without these kind of techniques. So those are really two great opportunities, the mesh and the irrigating fluid, to help avoid the adhesions. I'm trying to think if there's anything special unique about the surgery. Pretty much being awake, his surgical technique, and the formation of adhesions. That's pretty much about it. As I get more information, I'll pass it on to you. So I hope for those of you who've asked, that's informative, and for those of you who didn't and just wanted to know, now you know. Have a great day. 5 weeks to go.